Hello, this is Optimum Health for All. I'm your host, O J Odia. Today, we're going to talk about dementia. Dementia. Dementia is not a single disease. It's a basket of disorders grouped under the term dementia. And there are many types of dementia. The one that is most common that people know about is Alzheimer's disease. There are other types of dementia, sometimes due to vascular abnormalities, changes in the vascular structure of the brain due to uh, maybe thickening, blocking of the vessels, and so on. Now, there are others due to vitamin deficiencies, um, thyroid disorders, and other such disorders, giving rise to dementia. Dementia is really common in the elderly, people who are 65 and above. And sometimes people call it senile dementia, but that term is currently being not being used as such. So it's just to say dementia. Now, what are the underlying causes of dementia? What causes dementia? That is one question we'll need to address today. But before then, what are the features of dementia? How does dementia present? How do we know that a person has dementia? Most persons with dementia usually present with memory loss, usually recent memory loss. They may remember uh, things that happened in the distant past, but recent memory is usually lost. Then there might be confusion, disorderliness, irritation, reasoning ability is impaired, logic is also impaired, and the patient may have paranoia, that is fear of impending death or doom or whatever, and then other anxieties. They may be uncoordinated. Sometimes they tend to wander, leave the house, not knowing where they are going or exactly where they are, and they may sometimes get lost. So it's a very serious disorder. They are not able to look after themselves and all that, and they may probably need somebody to, as a caregiver, to be able to make them live from day to day. So dementia is a serious matter, but to make a diagnosis of dementia, you will need a physician to examine the patient and take a good history and come up with a diagnosis. The physician may want to do some tests like blood levels, kidney functions, endocrine tests, and usually they will want to do a brain scan, CT scan of the brain. Also, may like to do MRI of the brain to see what structural abnormalities have occurred in the brain, whether the brain cells, brain size and structure have been affected. Now, what are the underlying causes? Sometimes we really don't know why dementia occurs, especially in Alzheimer's disease, for example. But there are some forms of dementia that you can trace to particular event or way of life. For example, those who participate in contact sports, combative sports, people like boxing, wrestling, and so on. That where you have repeated trauma to the head, those people may also ultimately come down. Some of them may come down with dementia as the years progress. So dementia is common in the elderly. As we go older, the possibility of having dementia also increases. Now, what are the underlying causes of dementia? What are the underlying factors? One of the underlying factors is metabolic disorders. Diabetes, for example, hypertension, that may predispose to developing this dementia in later years, in the later life. Now, the vitamin deficiencies, alcohol, excessive alcohol usage, cigarette smoking, the usual culprits that we're already talking about. Bad dietary habits, malnutrition, all this may predispose to dementia. Is dementia treatable or is it curable? Of course, dementia is usually not curable, but and is usually progressive. So the management of dementia is to prevent, to slow down the progression. That's the aim of management at this point in time, to slow down progression of the disorder. Sometimes dementia can be reversible. Some forms of dementia can be reversible, like hypothyroid disease. If we treat the hypothyroidism, there might be some improvement in the memory or the symptoms of the individual, of the patient. Vitamin deficiencies, to inappropriate vitamins, replace them, there may be reversal. But by and large, most forms of dementia is progressive and irreversible. Drugs can be used to manage the patient, usually symptomatically, maybe to sleep better, to reduce anxiety and paranoia, and so on. So but drugs usually will not reverse. For those types of dementia that are irreversible, drugs will not reverse the dementia, and the patient may continue to progress towards becoming worse and worse. Now, if drugs do not help patients with, say, Alzheimer's, for example, or for those with vascular dementias, then what can we really do to ensure that patients with dementia live a healthy life? Caregiving. Good patients should be nursed, that is giving good nursing care, palliative care, make them live from day to day, make clean, give them their medications, bathe them if necessary, if that is they are not able to do toiletries by themselves, and so on. So a good tender care would help the patient at least survive, live from day to day. Is dementia preventable? Well, there are factors that may reduce the risk of developing dementia, reduce the possibility of developing dementia. This will include a healthy diet, a healthy diet that covers all the nutrients that a patient needs, that a person will need from day to day. So we really call the balanced diet. And the diet should be rich in fruits, vegetables, so that we have enough vitamins and minerals for a good brain health. Then, apart from that, exercise. These are things that we talk about in healthy living. Exercise, 30 minutes of brisk walk, at least 3 times a week, or most of the week, will help reduce the risk of developing dementia. Then we talk about things that will stimulate brain function, that is, get the brain to work. So things like crossword puzzles, playing games like chess, Scrabble, and so on, learning a new skill especially in the elderly. As you grow older, may learn a new language or try to learn a musical to play a musical instrument, piano, guitar, and so on. So that to help stimulate the brain to be continuously active. So an active brain is less likely, very less likely to have dementia. So we'll need an active brain. So getting the brain to be active is very important in minimizing the risk of dementia. Now, another thing that we will need to do is social activity. When the patient is involved in full social activity, going out, going to socialize with others, and taking part in maybe sports and other social activities, the tendency to develop dementia is much reduced. So those are the key things, apart from the fact that you have to keep yourself healthy. All the disorders that usually will predispose to dementia, like vitamin deficiency, hypertension, diabetes, all that should be kept under control. So if most of these things are done, the tendency to develop dementia in later years will be reduced. So prevention usually is the key to not developing dementia, because once patient has dementia, management is pretty not very smooth sailing. And prevention, as we say, usually say in this program, is the best form of therapy. Prevention is better than cure. Thank you very much, ladies, viewers. Thank you very much, viewers. We're happy that by listening to this program or you're viewing this program. Please subscribe so that you can have future updates on this and other episodes that will bring to you. This is Optimum Health For All. We'll have to modify our name a bit because we want to reach a much wider audience. Our mission is to reach a much wider audience, to reach as many people as possible. So this is Optimum Health For All. Thank you, and bye for now.